Hi, welcome to another episode of Talking with Docs. I am Dr. Paul Zalzal.
And I'm Dr. Brad Wiening, and on today's episode we're going to be talking about sprained ankles.
Sprained my ankle. So this common injury, sometimes it comes to the orthopedic surgeon, and often it's managed by the primary care physician.
Yeah, I'd say most commonly we see it when it's really, really bad and they're worried that something more serious is going on because of the severity of the pain.
Right, or sometimes there's a finding on an x-ray and the initial assessing clinician is worried that there is actually a fracture there. That often is another way that we get these.
Okay, so Paul, how does this usually happen, sprained ankle?
Sprained ankle is usually an inversion injury to the ankle, so you're walking along and you turn your ankle basically on some uneven ground.
Rolled my ankle.
Yeah, exactly, or stepped in a pothole or something like that.
Or I'd say basketball, volleyball players, they land on someone else's foot. Yep. That's a common mechanism, it seems.
Yep.
Okay, so how do they present?
They present with, well, if you pass me the ankle, they present with pain and swelling often will look like a little golf ball sort of over the side of the ankle. And while we have the ankle, why don't we run through basically what a sprained ankle is?
Sure. So a sprained ankle really refers to the ligaments of the ankle that are holding the bones together. So ligaments hold one bone to another bone. There are probably three main ligaments that we talk about. Two of them are on the outside or the lateral side of the ankle. One of them is called the anterior talofibular ligament, or the ATFL, and that goes from this long bone, your fibula, to your talus, right here. And then the other one is called your CFL, your calcaneofibular ligament. It goes from your calcaneus, your heel bone, to your fibula. And on the inside, there's one ligament. It's a broader ligament that goes from the inside part of your tibia or your medial malleolus down. It's called your deltoid ligament. It connects to the medial side of the rest of your ankle. So most commonly, when Paul's talking about an inversion type injury, the two on the outside are disrupted, and that causes, pain, swelling, bruising, and lack of a motivation to weight bear.
Right, and your x-rays are, well, your physical examination shows some tenderness there, some swelling, and the x-rays can be normal.
Yeah, so sometimes it can be normal, and sometimes a little flake of bone will come off, and the radiologist or the report will say there's an avulsion fracture, and then a lot of people are worried then they have broken their ankle.
Yeah, but really it is a sprain. So how do you treat these?
So there's a bunch of different ways. The number one way to treat it is with immobilization, and I'd say in my practice nowadays, with the advent of good walking boots, I usually hold them in a rigid boot. If someone does not want to wear a boot and they prefer a cast, we can put them in typically a weight-bearing cast, fiberglass or plaster if you wanted.
Yeah, so if it does make its way to one of us, then it's going to get treated in a boot to prevent motion of the ligament, to give it time to heal. But I'm sure there are millions of people who've sprained their ankle and never even gone to see a doctor and just sort of walked it off, basically.
Sure, which I think, I guess if you can walk it off, it probably speaks to the fact that it's not as severe. But some people are just really tough, and maybe they walk off things that should have been treated in a boot.
Yeah, agreed. How long does it take for a sprained ankle to heal?
So I treat them like a fracture. I keep them in a boot for 6 weeks, and the part that I think is a little bit variable, I make them wear the boot even when they're sleeping, which is super annoying and inconvenient. But what I tell people is that when you're sleeping, if normally I want you in the boot kind of in this position, when you sleep, your foot falls down and then usually it rolls in, and then those ligaments are in a lengthened or elongated position, and I want them to heal short so that they're nice and tight and they can do their normal function and be stable. So I tell them they have to wear the boot even in bed 4 to 6 weeks.
To any of my patients watching, who I tell not to wear it at night, you should probably wear it at night. It's a good explanation, good reasoning. I usually don't put them on, tell them to wear it at night, but I think that's very good logic there.
I'm not sure that my patients do wear it at night, but I tell them that they should, and they tell me that they do, so I'm not sure.
They probably don't. Have you ever sprained your ankle?
I have, and actually it happened, I was jumping over a church bench, and I rolled my ankle, and it was so large and so swollen I couldn't walk on it. I could have swore I broke my ankle. I couldn't walk for like a week. Yeah. I was on crutches, and it was very, very painful. I was not treated in a boot.
Church bench hopping is probably one of the leading causes of ankle sprains. And I used to tell people it takes about 6 to 12 weeks until I sprained mine. I was demonstrating a soccer move to my son. Turned out to be a how not to instructional series. But sprained my ankle, and it took like 6 months before I could show some more soccer talents to him.
It's very slow, and it's very frustrating too. And I think that's what's easier maybe about a broken bone is that once you see the X-ray, it's healed, then you can kind of get going. At 6 weeks, Paul, say you get it, you say, okay, now you can start getting out of the boot. Do you get put into physiotherapy?
Yeah, I'm a big believer in physiotherapy because first of all, if you've been immobilized for a while, you're going to get muscle atrophy. So the muscles are going to get weak, and they need to be strengthened again. And there's also some modality treatments that can increase blood flow to the area to help the healing as well. I've been starting to get people into physio a little earlier too.
Okay.
I'll put them in a boot, but I'll say, look, go start some physio at 2 weeks for a sprain.
Okay. Tons of questions for me from particularly younger athletes that want to get back to sport. Do you get them to wear a brace permanently for that activity going forward?
No, I don't. I get them physioed and strengthened, and I don't make them wear brace permanently unless they become a recurrent get a recurrent situation where they keep injuring or spraining their ankle. So what are some of the complications here of a sprained ankle?
So one of the complications is recurrent spraining of your ankle.
Yeah.
And ultimately, if you sprained it bad enough or had a bad enough injury, you could ultimately lead to a fracture as well. But if those ligaments become permanently ruptured and displaced, you become prone to rolling your ankle even with minimal trauma or no trauma, and then you could risk of falling and hurting yourself. So what do you tell those people as far as options going forward?
Well, you're not going to be hopping the church bench if that's the situation. You're going to have to, there are treatment options for that. More physio, of course, if you haven't done a full course of physio, but there are surgical interventions where we can go in and actually repair the ligaments or tighten the ligaments or recruit other tissue there to act as a ligament to try and stabilize the ankle if you do have this unstable ankle. And now, if you do have this instability, you are, as Dr. Weening said, you could suffer a fracture or you could damage the joint, the articular surface. If you go on to develop an instability and recurrent sprains, you could end up with post-traumatic osteoarthritis down the road.
Yep. And the trouble with the operations is that they're not universally successful. They're complicated operations that require a very special skill set and even further immobilization, often in a cast for 6 to 12 weeks afterwards. Just back to the splint for me, what I do tell my patients that are volleyball or basketball players, because there's such a high risk of jumping up and landing on someone else's foot, often they can purchase a lace-up ankle strap just to give them that support, or if they have a team therapist, sometimes they'll get their ankles taped.
Yeah, reasonable.
Yeah. Okay, that probably just wraps up ankle sprains. If you guys have any further...
Wraps up.
Wrap it up. If you have any further questions about any topic, please feel free to email us at info@talkingwithdocs.com.
And remember, you are in charge of your own health.
And if you felt this video was useful, please like it on YouTube or subscribe to our channel, and we'll see you next time.
Thank you.